Hi, everyone. Good morning. Welcome to our webinar. We're just gonna wait a couple of minutes for people to join us this morning. Thank you. Good morning, everyone. Thank you for joining us. We are about to start. We're just waiting for one more minute for people to join us. We're slowly watching our attendees list grow a little bit, so that's very good news. Thank you so much for joining us. Okay. So good morning again. Welcome to this webinar. My name is Maria Huerta. I'm part of the Resilient Civil Society activity being implemented here in Mexico. And it is my pleasure to welcome you to this session in which we're going to share with you our experience so far, prioritizing mental health for organizational resilience. So welcome. Our agenda for today is quite ambitious, I guess, but hopefully we're going to be able to get through this because we think it's important to share the context in which we're doing this, why we're doing it, and why we think this adds value to our development agenda in Mexico. So here are some of the issues that we're going to touch upon. Thank you. The next one. And I just want to remind everyone that this webinar takes place within the Evidence for Impact webinar series that Social Impact has organized for the past couple of months. And you can watch plenty or many more webinars that have gone for the past couple of months. You can see the links here, and you can join us on our next webinar happening on the 14th of April on development evaluation, a tool for operational effectiveness. So I just wanted to share that this is happening within that space. And today we have a very interesting panel talking about what we've learned so far here in the Resilient Civil Society activity. Joining us today is Irelia Blanedo, the RSA's COP, Flor Ramirez, she's the Capacity Development Lead at RSA. Myself, I'm the Collaboration Engagement Lead here in RSA as well. Marco Valencia, who's a multi-sector specialist, and Tania Melchor, who's our very, very special guest today. She's the Lead Innovation Director at GES Mujer, a local CSO that's been implementing their work for 40 years in Oaxaca, Mexico. So I'm gonna ask Ireri, our COP, to share with us what the Resilient Civil Society activity is doing in Mexico. Thank you, Ireri, for joining us.
Thanks, Maria. And thanks everyone for your interest on this topic. We're really excited about the opportunity to share with you what we have been doing in the Resilient Civil Society activity to prioritize mental health as a component of CSO resilience. So just a little context, the Resilient Civil Society activity is a 4-year initiative. We started a little bit less than 2 years ago, May 2021. The initiative is implemented by FHI 360 in partnership with Social Impact and with ICNL. And our main objective is to promote the resilience of civil society organizations in a context that we recognize as a challenging one. We have been going through years of change. So we need to provide organizations with the capacities to navigate this environment. Next one, please. Yes. So we have three components. One is focused on capacity development of organizations. We lead participatory processes, focused on strengthening institutional capacities. We also work on multi-sector collaboration and engagement, recognizing that civil society organizations don't operate in a vacuum. They need to work with other sectors and engage their target audiences. And we also work in promoting recognition of the work of civil society organizations. We're in a context in which the role of CSOs is being challenged. The value of the work is not always known or understood by the general population. So we also work in helping organizations to communicate better what's the value of the work. Next one, please. So first of all, we have been talking about mental health a lot in the development sector for quite a while, either about the relationship of mental health with other phenomena like the opioid crisis or violence. But we also have been talking about mental health as a priority a lot since the COVID pandemic. And we think this has gone much more mainstream. Policymakers, organizations, other actors are talking much more about the importance of mental health. We have been seeing an increase in anxiety and depression around the world, or at least we have been able to recognize that phenomenon as something that is increasing. Maybe it was something that was a little bit hidden, and now is at the forefront. And we recognize that mental health is a public health priority, but we don't always dedicate all the funding and all the attention that it requires to this problem. Next one, please. So why is mental health specifically important for CSOs in Mexico and for the, well, CSOs in general, but specifically for the CSO that we're working with in Mexico? First of all, we already know that this is a sector, the nonprofit sector is a sector that is prone to burnout. Many of us have heard about the nonprofit starvation cycle, where little or medium-sized organizations are struggling to get funding. They have limited resources, so they get stuck in a cycle where they don't invest enough in capacities, and that in turn causes them to have even less resources to do their work. And another reason is many of these organizations are already working with vulnerable population. That leads to compassion fatigue, but vicarious trauma experienced by the staff that is doing all this emotional labor, tending to these populations. So these are factors that were already there for a long time, but we're also experiencing new challenges due to a new environment. The COVID pandemic, as I already mentioned, has been particularly challenging for many of us, but for CSOs in particular, they saw an increase in the demand for their services, and they were still struggling to adapt. We also see in Mexico that human rights defenders and CSOs are oftentimes targeted by organized crime and human rights violations. We are seeing also changing landscape in terms of funding. This is not exclusive to Mexico, but we have been seeing that a lot. And a negative narrative about CSOs. The current administration is very, has been questioning the role of CSOs in development for a while now. And this has sparked a conversation among many sectors on whether or not the role of CSOs is important for development, for democracy, for the country. And that's, hardly motivating for many people working in the sector. And also the effects of burnout and compassion fatigue are starting to pile up after a couple of years that have been quite intense. So we already identified those factors, and we decided that mental health had to be a central factor of our approach to organizational resilience. Why? Because in essence, we cannot strengthen the resilience of organizations without strengthening the resilience of the people that work there, without paying attention of what's the effect on the staff and voluntary people that work in the organizations. Promoting mental health internally can positively impact the resilience of CSOs. Something that we have known for a while, when we rely too much on the capacities of individuals to keep the organization going, that leads to staff turnover, to the loss of capacities in CSOs, but it also leads to a crisis in meaning and what's the core of the organization. Organizations often are fighting to promote the rights of others and forget about the rights of their own staff and their team. So this is also a matter of being consistent with what your values are. So this is why we started to talk about the importance of mental health in our program. We also validated this in our co-creation phase. When we started as a program, we had a co-creation phase where we talked to civil society organizations, experts, key stakeholders. We knew the program was there, but it's often not recognized. But at this moment in particular, because it was in the middle of the COVID pandemic, a lot of people were much more aware of the problem, and they were willing to prioritize this. And we learned, talking to these experts, to organizations in focus groups, that mental health and well-being were critically affecting organizations, and that they were willing to dedicate more time and effort to work on this. Next one, please. So now I'm getting to our theory change. After we did all this work, we decided to address the problem. What's the problem? Mental health and well-being of CSO leaders and staff deteriorated in Mexico due to overlapping challenges such as COVID-19, the lack of funding and decreasing public support. And this impacted CSO's resilience and weakened civil society sector as a whole. Our desired goal with our intervention was that CSO leaders would improve their awareness of the importance of promoting mental health and well-being. They would have access to knowledge, resources, and tools that contribute to organizational resilience. Maria, if you can help me with the next part.
Thank you, Ireri. Yes, well, as Ireri was saying, this was our theory or our hypothesis after our co-creation phase. So after designing what we thought was what we wanted to see happen in the environment, we also realized that we have some assumptions, right? So the first assumption is that by having continued access to tailored information and resources on mental health and well-being, this will generate a change in awareness and behavior of CSO leaders and staff. And I want to highlight the role of leaders at this point, because it's very important that leaders take this on, and then this sort of like trickles through the staff, and it becomes an organizational awareness, a cultural change of behavior, if you want. We also have as another assumption, which is that CSO leaders and staff are willing to follow up with a plan that prioritizes their mental health, their well-being, and this is something that has to come, I don't want to say organically, but it has to have some willingness. It can't really feel like another objective or another task, right? This has to be something that really fits into their own objective to be well, to be healthy. And what are the desired outcomes that we want to see after this process finalizes? And we still have some time to do this. So we want to see CSOs that are stronger, that they're opening an internal space for mental health and well-being as a practice, as a discussion in their everyday work. And we want to see leaders and staff that have the ability and the tools to develop coping mechanisms and a sense of duty of care, which is really, really important, right? And this will ultimately contribute to the delivery of high quality service to their target populations. So this is, I think, the key, right? If people are well, they are better equipped to serve the populations that they work with, to have a higher impact on their development agendas. So I guess this is a key aspect of our work. And so we have some cross-cutting, the program rather has a cross-cutting focus on mental health and well-being. And at this point, I'm going to ask Flor, who's the capacity development lead at RSA, to explain to us what we're doing in this area.
Thank you, Maria. Yes, so we understand understand that mental health and well-being component is for us a capacity development issue. It's a capacity development topic that is relevant because, as Ireri mentioned, we have like a sort of this umbrella of resilient approach, and we found that work in this topic is really, really important. It's a critical factor to could reach other kind of capacity development outcome there in organizations. So I just wanted to share that one of our first key decision for adaptations in this program after co-creation process was precisely how we are going to integrate this and how we are going to become operative the mental health components. So I want to talk more about how we see with our grantees, with our CSO grantees, because our strategy is comprehensive, but for grantees organizations, we are trying to foster this integration of staff well-being and mental health practice into the institutional policies and activities. So we think that this is the opportunity to provide a specific and dedicated funds for this topic that is really relevant, and to give access to some organization for a comprehensive pool of specialized consultants and experts and people that can support their work, providing these activities or the options that I'm going to talk more about. And also is create a learning community that can have access to specific events, moments, spaces that are dedicated to address these common changes, basically, because we know that COVID pandemic bring also in some time or in some cases a disproportional workload for some people of CSO. So the way that we envision this is that we wanted to be sure that we were in line with best practice. So we consult a lot all these guidelines for approach mental health in line with interagency standing committee that is like all this community of the humanitarian world. So we wanted to be sure that we want to give the opportunity that take and have in mind the best standard for this. So we basically offer to our grantees is that during the agreement negotiation, we can have they can have like two options. One is a more the option to integrate this topic with a very specific plan of activities that receive professional support of external and experts to in order to strain the individual and collective coping mechanism to deal with adverse situation or basically with the stress for working or for search with vulnerable population. And the other options is really related with the Mexican context. We have new guidelines that is promoting well-being in workspace. In Mexico, this guideline is named NOM 035. That is basically that all these workspace or team that are more than 50 people can have it can take seriously, have to promote a well-being, have to promote mental health, and have to prevent some psychosocial risk in the workspace. So basically, this NOM 035 is looking in Mexico to have protocols, to create policies inside the organization that can promote these mental health issues. Is basically a positive work space for everybody as a strategy to reduce stress. So we have these two options. We have this plan of activities, and then we have the opportunity to create a more institutional strategy that go in line with a NOM 035. So next, please. Yeah. So how does it work? So as I mentioned, RSA basically had to do a previous work, gathering information of market costs, interviewing potential service providers, and code who types, the two options that I already mentioned and that we call package. So CSO interest in participating in mental health and incorporating this also have to express this interest during the agreement negotiation. So in this stage, RSA work with each CSO to incorporate mental health activities into the project description, because we wanted to be sure that it was an institutional priority, that it's absolutely voluntary if some organization decide not to access to this specific opportunity. And then we also work with each CSO to be sure that we were allocating the needed budget for this. This is something very important and relevant for us, that is given a specific allocation of the budget line in order that each CSO can basically hire the expert, the consultant that is a sort of like market, like a market. So they basically choose the best one that make fit with the organization, with the scope of work. And we as RSA team was only trying to care that the approach can be relevant in line with these two options. So core principle and all these, and it also need a relevant work with providers, that all these process and intervention need to be culturally relevant for people, respecting basically their own context, their own practice, their own religion and belief. So we really had to really foster confidentiality and do not harm approach, because with this we are really aware that organizations are starting to find and become aware of that stress, workload need to be moderated. So, but with this process, we want to be sure that we are trying and we are really caring the not harm approach integrated there. So, in the promotion of continuity of care, but because this has to do that sometimes we understand that at that level of process of intervention, probably during the process are going to be some specific case that need specialized attention. So we are trying to really create this awareness that after the process or during the process, we need to detect if we have something very specific in order to promote a continuity of care that probably need other level. So, and just like a sort of example of what kind of activities we are doing. The next, please. So basically, until now, that we are benefit 7 organizations, and we are almost starting with 10 CSO grantees. So the kind of activities that they are doing include staff strategies to raise awareness about mental health, like a first step, co-design and implemented well-being self-care practice plan that, as I mentioned, need to be aligned with the NOM 035, collaborative leadership practice to better support the team performance, activities for positive peer-to-peer relations that build trust between the staff that contribute to the positive work environment, training and collective care sessions, but also individual care sessions to prevent or address burnout, grief and trauma, and also technical assistance to develop this protocol. We are trying to put attention on how after this project cycle, RSA project cycle, we really can find this opportunity to that in order that CSO can take ownership of these process, policies, and routine and practice. So we are really excited with this first round, And we have, yes, good comment until now, and really good expectation that when it's going to come. So I'm going to ask our colleague of social impact to talk more about the next component.
Thank you, Flor. Okay, so the second objective of the resilient civil society activity is actually to strengthen the local system through increased networking, collaboration, and engagement. And so, in other words, our contribution to this incredible program is to think of ways in which we can strengthen organizations by having them connect and link and network with others, be them organizations, the government, academic, the private sector, other key stakeholders within the local system who can engage with the civil society sector and strengthen their development agendas. So in this component, we have developed 3 ways in which we're contributing to the mental health and well-being perspective. And so I'm gonna let Marco Valencia, who's our multi-sector specialist, explain to you how we came up with TELAR and what we're doing in this specific program, and the experience we've had creating our own very unique failure fest. So there you go, Marco.
Thank you, Maria. Hi, everyone. Thank you very much to everyone at Social Impact and all my RSA team, of course. I'm very honored to participate in this space. I will talk about TELARs, which mean Loom. So within RSA, the Social Impact team has developed a collective learning activity called TELAR, designed to promote and maintain collaboration among participating CSOs through networking dynamics. TELAR is made up of virtual learning activities that are related to each other to obtain better results and depth into the contents. It composes that the first one aspect, the first activity was the webinars. This is one frame of reference for each topic with the participation of experts. They share critical theoretical concept, evidence, practical tool, and resources, as well as a possible practitioner actions. The second one in this depth approach was collaborative workshops, connect to the webinars topics, and they were designed to promote collaboration between organizations and specialists to share and apply practical tools through participatory dynamic spaces. The last one was the knowledge sharing sessions. The third one that we want to sharing promising practices and real situations, assumptions, and experiences with real examples and scenarios. The purpose is to convene a space for dialogue, mostly, to incentivize the involvement of participants, CSOs, in ERING networks. So yeah, that was the 3 principal activities here in TELAR. It's good to know also that TELAR promotes sustainable peer-to-peer formative dialogue, built around learning model for generation and consolidating alliances, following the perspective of collaboration, learning and adaptation, CLA, and the model of active teaching, learning by doing. That allows the exchange of good practices, tools, and practical knowledge, and seeks to build from experimentation. All these TELAR activities emphasize CSOs staff mental health, of course, and well-being, among other factors, as key aspect of organizational resilience. That is why the team designed 2 collaboration and engagement activities to promote the mental health, particularly of CSOs practitioners. The first one, this is the things I mentioned before, a mental health webinar workshop where over 290 people access practical resources to design and implement mental health plans and address the challenges of their work. The second one, it was this that mentioned Maria before, a tailor and facilitate failure fest, the failure fest, where failure was normalized as part of continuous improvement culture, and CSOs are incentivized to recognize, share, and learn from failure as a strategy for resilience. And guess what? A cross-cutting issue among our 4 participants was the neglect and deterioration of their mental health and self-care. Yeah, the speakers shared their resilience experiences, and the challenges it represents. And thanks to that, we obtained very good recommendations and findings on how to achieve as individuals and within our organization. Fortunately, after observing the failure phase, the client, the USAID Mexico, requests the social team to present the failure sharing methodology and result to USAID mission staff. Within RSA team, as the agency is interested in replicating the approach themselves in a vertical risk-averse organization. So yeah, that's the story with LR, which means LUMS, and it's about this networking peer-to-peer learning. So Maria will talk about our community, our learning community. Maria?
Thank you, Marco. Okay, so maybe the previous slide was just a quote from one of our guest speakers in the Failure Fest, who shared with us what the challenges are of being a leader within the civil society sector. And we've learned a lot about what they face and how they learn to navigate the challenging environment of being a leader within the sector in Mexico, and all the other overlapping challenges that have happened over the past years. So we really want to embrace what leaders have to say and what they share with us in terms of mental health and resiliency. The next one, please. So I'm going to share with you what we've done through our learning communities. The learning community model within RSA is a space that the RSA team convenes with CSO grantees. The previous two activities, DELAR and Failure Fest, are designed for the sector as a whole, so anyone can join the DELAR sessions. They're made for the civil society sector as a whole, whereas learning communities are designed for CSO grantees who are part of RSA. Learning communities, as you probably know are communities of practice in which we share knowledge, we share tools, we share resources, and we promote the collaboration between organizations. And so within this context, we've attempted to include the mental health and well-being component in these spaces. So the first opportunity we had to do this was in last year in Oaxaca, and we had the amazing help of facilitating a mental health and well-being session with Hes Mujer, who's actually, Tania is joining us in a second to share their experience in this topic. But in this space, we learned very important lessons, and I want to share those with you. The first one is that mental health is not a product to be obtained, but a process to be built. And we think that is very important, as it's not really something that you achieve and you tick off a list and you say, perfect, we've achieved mental health and everything is great, which is something that we tend to do within, development projects. We're like, yes, we've done this and this and this, and achieving indicators, etc. But mental health is actually something, is a long-term process that we need to have patience with and we need to build carefully. The second thing we learned is that there are multiple alternatives to build a healthier and more resilient team within organizations. And that is, that takes on two aspects. The first one is having self-compassion and what you do to take care of yourself as a person. But then at the same time, we need to have an institutional design or a structure that promotes a healthier mental health culture and organizational awareness, as Flor was sharing. So at the end of this processes so far, what we've learned is that it's not only about you and your decision to take care of yourself, but rather it has to come hand in hand with an organizational decision to include this in the culture. So we always say an example of this, right? I can be the healthiest person, but if my boss sends me an email at 3 a.m. in the morning, that really doesn't contribute to my mental health. So, it needs to be coherent in that sense. So that's what we've learned in the learning communities. And we've also tried to promote spaces where organizations can share with each other the challenges they're facing. And that becomes a safe space for organizations who don't usually have the time to think about this, to really reflect on what it means to be part of the sector and the challenges they're facing. And only by sharing and by sort of seeing themselves in others, it becomes like a whole different thing. And I've realized by listening to organizations that they feel understood and they feel like they're not alone, right, in facing these challenges. So now I want to take a moment to introduce Tania. who's joining us from Oaxaca, Mexico. And I'm gonna, Tania is part of the directors of GES Mujer, an organization that has been working in Oaxaca for the protection and promotion of human rights, of women's human rights in Oaxaca and in Mexico. But I'm gonna explain to you how this is gonna work. So Tania is going to share their experience in internalizing what mental health and well-being actually means in their everyday work. And I'm going to do a simultaneous translation as she shares with us. So hopefully this is going to work. Bienvenida, Tania. Adelante.
Gracias, María. Pues sí, como tú ya lo mencionaste, nosotras tenemos 45 años trabajando por la defensa de los derechos de las mujeres en Oaxaca. Hemos visto en esos 45 años momentos muy oscuros de los movimientos sociales, pero también momentos muy luminosos y esperanzadores, como creo que es este momento. En este tiempo, nosotros hemos trabajado con diferentes grupos de mujeres de la diversidad sexual, adolescentes, mujeres de comunidades indígenas, afromexicanas, y poco a poco en este tiempo se han visto cambios. No son quizás cambios enormes, pero sí cambios significativos, cambios en las familias, en las mismas leyes, en la escuela. Y entonces nosotras nos sentimos muy satisfechas cuando vemos esos cambios, pero también todo este trabajo por la defensa de los derechos humanos ha tenido graves repercusiones en nosotras, en nuestros cuerpos, en nuestras vidas.
Okay, thank you, Tania. So I'm going to translate what she just shared with us. She mentioned that GES Mujeres has been working for 45 years in Oaxaca, and they've done this by protecting and promoting women's human rights. Specifically, they work with women who are sexually diverse, adolescents and girls from different backgrounds and contexts. For example, indigenous Afro-Mexican women, and within indigenous communities. And they've done this for a while now, and they are living in a very special moment because at the same time, they're seeing the changes that are happening both in public policy, in institutions, in families. They're seeing how their work has an impact and is becoming a reality. But at the same time, this has had a strong impact in their minds and in their bodies. And they have felt this as a team.
Recuerdo que un 8 de marzo de hace 2 años apenas, nosotros normalmente salimos y marchamos ese día, además de todas las actividades que hacemos durante el año, pero no podíamos salir a marchar porque estábamos en plena pandemia y decidimos sentarnos, reunirnos nosotras como organización, como grupo y hablar de lo que estábamos sintiendo en ese momento. Lo que vimos no nos gustó porque realmente éramos mujeres que estábamos muy cansadas, agotadas, con problemas de salud físico, pero que nos dimos cuenta que eran problemas que tenían que ver con lo mismo que estábamos viviendo, con la presión, con el no darnos tiempo para nosotras mismas. Había problemas grandes de insomnio, incluso de desesperanza. Así que decidimos que cada 15 días íbamos a hacer un alto en el trabajo y que íbamos a hablar de cómo nos sentíamos y tratar un poco de erradicar esa creencia de que las defensoras de derechos humanos solamente estamos para servir a otras personas, para apoyar a otras personas, sin pensar en nosotras mismas.
Thank you, Tania. So Tania is sharing with us that this internal awareness and reflection began a couple of years ago on the 8th of March, which is, as you know, the International Women's Day, which in Mexico is a protest day. We protest, we take the streets, and we express our discontent and our expectation that human rights are protected for women. So they couldn't march, they couldn't protest because they were in the middle of the pandemic. And they took this opportunity to make a team meeting and really reflect on how they were doing, the staff, the directors of this organization who have been there for years and who are working on defending the rights of women. And they realized by looking at themselves that they really didn't like what they saw. They saw fatigue, they saw burnout, they had insomnia, they had chronic anxiety and a variety of stress-related affectations and aches. And so from that point onwards, they decided to prioritize mental health for the women who work within GES Mujer, and implementing activities to promote this, such as they implemented an activity called Growth Thursdays, and they realized that the fact that they protect other people doesn't mean that they can't care for themselves first. And I saw someone mentioned in the chat that the gender perspective is so important when talking about mental health. Indeed, right? So women always take the role of caregivers, and we sometimes forget that whomever we are and whoever we're protecting, in this case, victims of violence in Oaxaca, the women leading GES Mujer also need to take care of themselves.
Y justo en ese tiempo nos llegó una convocatoria de la Fundación Freedom House y a la cual accedimos, y nos financiaron un proyecto que se llama El Mundo que Soñamos. Gracias a este proyecto pudimos pagarnos exámenes físicos, también tener diferentes talleres y terapias individuales y grupales, donde empezamos a conocer estrategias, a conocer también nuevas maneras de tratarnos a nosotras mismas. Empezamos a hacer conciencia sobre lo importante que era poner nuestra vida en el centro para poder atender incluso mejor a nuestras usuarias, a las demás personas con las que trabajamos.
Thank you. So Tania sharing with us that when this internal reflection took place, fortunately, they were contacted by Freedom House, who offered to finance a new mental health project, which is called The World We Dream. And through this project, they were able to invest in sort of like a holistic medical attention that included their physical health, their mental health. They had access to psychologists who tended to their mental health. And through this process, they understood that they needed to address and to pay attention to what they were feeling, as well as the work they were doing. They've received individual and collective mental health attention. And through this, Tania is expressing that it allowed the team to really reconnect with themselves and access new resources that place their well-being at the center of what they do.
Y los frutos, este proyecto lo iniciamos hace un año y ahora los frutos ya se están viendo, porque además de los cambios a nivel personal, también hemos empezado a hacer cambios en la colectiva, hemos estado haciendo nuestras políticas que tienen que ver con autocuidado. Por ejemplo, antes de las actividades incluimos pequeños rituales, también rituales ancestrales que tienen que ver con la energía, con nuestra espiritualidad. Y limpiamos la energía en los espacios, armonizamos nuestros espacios. También tenemos pequeños cambios, como por ejemplo, bailamos a mediodía, ¿no? Diariamente bailamos, y además de que movemos el cuerpo, pues nos reímos y disfrutamos ese momento para poder continuar con nuestras actividades. También algo que sentimos que nos hace mucho bien es que hemos cambiado los refrigerios. Antes solamente era café y galletas, ahora procuramos tener fruta, tener verdura, y sobre todo también hemos empezado a ponernos algunos límites con lo que tiene que ver con nuestras agendas laborales. Estamos marcándonos tiempos para terminar los trabajos, estamos limitando la parte de la conexión por WhatsApp o por correo hasta cierto momento del día. Entonces, estamos empezando. Son pequeños cambios que se notan.
Thank you, Tania. Okay, so Tania is sharing with us that the results of this process are already visible. And she's mentioning something that is very important, which is, as an organization, as an institution, they've already started to generate changes, right? And she's sharing with us a few examples of how they've done this. For example, they've included rituals to clean the collective energy, to harmonize their space. And these are rituals that are connected to like ancestral knowledge that is very present in Oaxaca. They take a small break every day at noon, and they all meet at in a specific spot that we've seen in GES Mujer, and they dance around and they laugh and they sort of inject joy into their work, which is so important considering what they're dealing with in every day. They've also replaced their traditional sort of carb-based coffee break with donuts and cookies, with healthier options like fruits and vegetables. And they've seen that this has a really strong impact in their mental health and their general well-being. And I think something very important, which has to do with, that connects with how the sector works as a whole, is that they've realized the amount of time that they work, and they're trying to limit that and to be aware and mindful that they can't overdo themselves. They can't burn out working. And this has to do with what Ireri was mentioning in the beginning, which is they're working in such important issues that resting seems like a privilege. And if you think about what other women, for example, are dealing with, and the suffering and the human rights violation, that seems like, why should I stop if others are suffering? But in fact, the narrative has to change. We also need to take care of ourselves if we want to take care of others.
El desafío todavía es muy grande para las personas que aspiramos a tener un mundo con justicia y dignidad. Todavía nos hace falta mucho trabajo, lo sabemos. Por eso es que para nosotras en GES Mujer es importante colocar en el centro el autocuidado, colocar en el centro el cuidado colectivo, colocar en el centro nuestra vida. Porque el bienestar no tiene que ver con una posición de privilegios, sino es fundamental para el sostenimiento de nuestros movimientos. Sabemos que si queremos continuar con la lucha que hacemos, con el trabajo que hacemos todos los días, necesitamos estar bien nosotras primero. Y por eso todo esto que hemos aprendido lo hemos querido compartir con otras organizaciones, con otras mujeres defensoras de derechos humanos, y ahí es donde llega el proyecto de USAID, que nos ha permitido compartirlo. Hemos hecho ya productos metodológicos, estamos haciendo un manual, estamos haciendo tarjetas, en donde estamos sistematizando esta experiencia y ya empezamos a compartirlo con otras mujeres, porque sabemos que estas mujeres, líderes también de sus organizaciones, van a compartirlo con sus propias organizaciones, y de esta manera vamos abriendo camino en lo que es el bienestar.
Thank you, Tania. So Tania is sharing with us that women who work towards a more just and fair society still have a long way to go. There's still a great challenge ahead, which is why they realize that they have to prioritize mental health as a critical aspect of their work. And as I said before, they realize that their well-being and the organizational actions that they take to promote collective care have to be a priority, recognizing that this is key for the sustainability of their work. So in other words, if they want to continue to promote and human rights, they have to be well, they have to take care of themselves, they have to be healthy. And she also shared that this whole process has given GES Mujer a lot of experience, and they're very keen to share these experiences, and these they're working towards the systematization of what they've learned so far. And this came in really handy when they began to be part of the Resilient Civil Society activity as grantees, because they're now sharing these methodologies that they've systematized. They're working to create manuals and tools to help other women who are human rights defenders take care of themselves and their mental health. And they, through this work, they aim to contribute to a more sort of systemic change in which mental health and well-being is considered a priority for resilience.
Las experiencias al compartir este trabajo, estas prácticas de la organización con otras organizaciones, con otras compañeras, ha sido muy reconfortante, porque cuando ellas llegan, nos comparten, es que yo me sentía muy cansada, es que yo estaba a punto de derrumbarme, ¿no? Antes de esto, y ahora cuando comparto con compañeras de otras organizaciones me doy cuenta que no era la única, que todas nos sentimos así, y que la mayoría estábamos viviendo este proceso en solitario, pensando que era una cuestión individual. Sin embargo, cuando hablamos entre mujeres de cómo nos sentimos y empezamos a compartir pequeñas cosas que estamos haciendo, pequeños cambios, nos hace sentirnos más fuertes. Nosotras decimos, juntas somos más fuertes para las diferentes actividades que hacemos, pero también para cuidarnos a nosotras mismas. Juntas somos más fuertes. Entonces esto va haciendo que recuperemos el entusiasmo por nuestro trabajo, por nuestra vida. Sabemos que el reto es muy grande todavía, estamos empezando a trabajar en estos temas, pero estamos seguras de que no queremos seguir aportando a través de la tristeza y la muerte. Estamos convencidas de que aportamos más desde el gozo y la vida. Muchas gracias.
Gracias, Tania. Okay, so she's just sharing her final remarks, and she shared with us that there's some women who have shared their experience having been part of this process within HES Mujer, and they've learned a couple of things that Tania wants to share with us. The first one is that for many of the collaborators within HES Mujer, these activities, the mental health and sort of self-compassion activities, have been a tipping point. They were very close to burnout. They were very close to giving up and just saying, I can't do this anymore. And through these activities, they've found their center, their purpose again. And most importantly, they've realized that they're not alone in this process. And they share very similar emotions, right? And very similar sort of challenges that they can work together as a group, as a team. Tania also shared that these, like most affectations, such as burnout or depression or anxiety, can be improved through joy, through collaboration, through shared experiences. And even if they recognize that they have plenty of challenges ahead of them, they're sure that they can make a much more valuable contribution, not from sadness and death and victimhood, but rather from joy and from the pleasure of being alive and the joy of helping others. Thank you, Tania. That was amazing. I hope everyone, I know there's people in the audience who speak Spanish, and I know she's way better in Spanish than I could possibly translate, but I hope everyone got a sense of the important work that HES Mujer has been doing for years, and how they've contributed not only to RSA, as we've mentioned, but to the whole sector. So gracias, Tania. Here's a little quote that she shared with us that we wanted to share also. And now we are open. We want to share what we're going to do next steps within RSA. For this, I'm going to ask Flor to join us. Thank you.
Yes, well, Tania, really inspiring all this work and experience. And I would say from a capacity development approach, it's, that we are learning is that we really need to think and take seriously this, because in terms of the scope of implementation and sometimes the demand that we have for the implementation of a project, we need to find these spaces in the daily routine as HES Mujer has been doing and as all other grantees are doing. So we are really looking in the next months to analyze the result of this first group of CSO that have been benefit from the mental health components, really monitoring not only the satisfaction to implement these activities, but also to understand and try to capture lesson learned and adaptation that we have really this kind of of results or outcomes that probably we need to discover and detect, and we need time to know it. But also at the same time, we are really kicking off in the implementation of a second round of grantees that are integrating these topics. So we are really excited to have on board 10 new CSO that had already made their decision about integrate this. And we are really also aware that continuous work with mental health providers network is important, because this is something really new. It's not a matter that we don't have providers or expert or consultant in the ecosystem, but we need to create more awareness and to help them also to understand what is the civil society specific needs and how civil society in Mexico is integrating this topic. So this is an important and probably an invisible work, but we are really happy to find a space to also work with and to amplify this network of provider, consultant, expert that can really be strained in the midterm for service the civil society sector. So yes, we hope really to capture and to and probably to share more in the midterm about what the main finding and highlight of this experience with grantees.
Yes, thank you, Flor. And I also just want to add to that by saying that we're alongside this capacity development effort with our grantees, we're also sort of attempting to expand what we're doing within the local system through collaborative learning activities. So very similar to TELAR, where we want to create a series of webinars, workshops, resources that are tailored very specifically to what CSOs need and the challenges that they face that have to do with mental health and well-being. And so we're sort of this is still in the pipeline, but we're working towards creating these series of resources. And as I mentioned before, the learning communities continue to be a space where we can explore this further. We continue to listen to what organizations share, and this is at the end of the day our compass, what they share, what they think is critical for the sector. And we take on this, I don't know if it's a responsibility, but we take it very seriously because we have the opportunity to maybe take this information and take it to a higher level and create a conversation such as this one, where we can share why this is important within the sector. So thank you very much. I'm just going to leave it to Ireri to provide us with some final remarks. Thank you, Ireri.
I think we have just a few minutes, but for me, it's something that this component is something that I'm very proud of the team and particularly of the organizations that are doing this work. This has been a learning process for us, and I hope it has been interesting for all the people that participated here. We are happy to receive your questions, comments, feedback. If you also have experience with the topic, we would also love to hear about that too. So thank you, everyone. I don't know, I think we have like 3 minutes left. I don't know if anyone has questions that they want to introduce in the chat. Maybe we can answer a couple of them.
Someone mentioned about the importance of how salary and remuneration really impacts mental health and well-being, and I guess that's a very important aspect. I don't know, Ireri, if you want to discuss this a little bit more, how obviously the narrative of mental health can be very beautiful, but at the end of the day, if there's no support for the development of people within organizations, then it's a little bit of empty words. I don't know if you want to comment something about that.
Well, I mean, I think this goes back to what we were talking about at the beginning. When we talk about mental health, we cannot leave that to individuals only. If we tell our team, it's super important that you work on your mental health, that you take a break, that you value yourself, but we as an organization don't do our work, then there's a problem. So yes, of course, remuneration, but it's not only the salary is not only about the money, but it's about also recognition of our team, of their needs, of what they contribute to the organization. So yes, I do believe that remuneration is important. I don't believe it's exclusively that we should be focusing on, especially in a sector that we already know has little resources. So sometimes organizations don't have much of a room to work specifically on that aspect, but we can do other things. And of course, we should be also working on making sure that the needs, economic and emotional, of our team are covered.
Thank you. We only have 1 minute left. I don't know if there's another question. If not, we thank everyone for your time. And as Ireri mentioned, we're very open to collaborate and new ideas to build this up and strengthen this approach. If not, I want to thank Tania, muchas gracias. I want to thank all of my colleagues for being here today. Hopefully we can continue this conversation soon. Thank you.
Gracias.
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 Gracias. Gracias.